Today's a little educational video about spinal cord injury. So, the different grades, levels, and types. In my case, I have what is called C5, C6. C stands for cervical. So anything that is cervical is from C1 at the base of the skull to the seventh vertebrae. That's that little bump that sticks out on the back of your neck. From there you get into the T-spine, and then you get into the L spine. So anything above C7 is considered quadriplegia. I had someone recently wonder how a person with quadriplegia could drive a vehicle. And there's quite a bit of adaptive equipment. My level of injury at C5-6 allows for this wrist function, enough to pull this way also. Some people can't do that, depending on the nature of their nerve damage. I use this strap so that I can get around without flopping out of my chair. Some people go around without them. But a C5-6 injury can have what is called sparing below the injury level, and that happens to be the case for me. I can do this with my shoulders. I have the ability to pull my levator and scapula muscles, my rhomboids pull down, and that gives me full neck range and partial arm function. You see these areas that are thin, that's where atrophy happens, in areas that don't have full nerve innervation. So a person can have wrist function, the ability to move their shoulders, lift their arm above their head, even straighten their elbow like this. It took me a long time to get strong enough to do that, because with the peripheral nerves running outward to the fingers, there's only so much function to the tricep. The side of the arm that is that the tricep is on, and this half of the arm is partially numb, meaning that there's a numbness on the surface that can be best explained similar to your foot when you sit on it too long and circulation leaves and it falls asleep. I use this type of glove here with a rubber pad to push my wheelchair around. And see how my hand hangs like that? I cannot straighten my wrist to that angle from that direction. But I have strength for this direction. And that is all due to one little dominant muscle on the inner side of the wrist where that ball joint is. I have full hypersensitive feeling in the thumb and almost full-on numbness in the pinky, and the fingers in between have gradients of sensation. This is due to the peripheral nerves running from C6, C5 through the cracks in the vertebrae outward along the arm. And what has been cut off in the injury was that the spinal cord was both crushed and the spine was subluxed, meaning the top vertebrae were popped off to one side, stretching and squishing. So the vertebrae had to be straightened back out. Took a bone from the hip and fused, I believe, 4 and 5 for me, C4 and C5, because I believe, if I recall correctly, C4 was partially shattered. And then they did the typical Harrington rod surgery with about 8 screws, I think 4 rods, and a bracket in the front. Still have a scar in this area that's not easy to see unless I swallow. I have a probably 7-8 inch scar in the back of my neck. So that is a little more detailed explanation of quadriplegia. Quadriplegia means you have paralysis in all 4 limbs. but it doesn't mean that you cannot move your upper limbs to some degree. It just means that I have partial paralysis in my arms and full paralysis in my legs. We do have the capability for neuroplasticity. There's a lot of research going on, not just in the realm of Neuralink or the Asian versions of that, or the Swiss versions of that, or Swiss or Swedish versions. I believe it was Switzerland. I think there was a program going on in the UK also. There are stem cells, of course, that's been experimenting ongoing for a long time. And then there's the electrical filament that they implant into the spine, or implants into the spine, where they jump the injury site to give you some mental brain-body interface. I do believe that it is entirely possible, under the right conditions, for the body to regenerate its own nervous system through neuroplasticity and through the breakdown of scar tissue and the opening up of neural pathways. There are processes for that. They take a lot of work, dedication, time, effort, belief, and perseverance. So, all of that said, a C5-6 quad like myself can push a manual wheelchair. We don't need a power chair necessarily. We do have the ability to transfer onto platforms like beds. With enough upper body function, we can lift the rest of our body over onto a bed without even using what they call a transfer board or a slide board. Some of us, not all. And we have different techniques for that. Some of us can go swimming. Some of us, I drive a full-size van, and I've done that for probably close to 10 years now. So it is entirely possible with the correct equipment in a van. You're using hand controls, you're using a type of pin called a tri-pin that you use for steering, using a hand brake bar, and special seat belt and that kind of stuff. Different electrical equipment for running different parts of the vehicle. But it does take some confidence. Not everybody wants to drive after, especially I was in a car accident that broke my neck, and so but I just wanted to give some information out. A paraplegic is anyone below C7 in the T-spine and below, and that would give them full arm function most of the time. That means triceps, biceps, able to open their fingers, open their hands, grab things. I have a tool here because I cannot open and grab. I have a wrist-driven device like this, grabs things, picks things up. Example. And so that's how I get a lot done. Sometimes people joke in my friend circle, those with disabilities will call me a super quad. I'm certainly not the only one, and certainly not the first in that regard. And then there's tenodesis, which a bit of wrist pulling back and just a little bit of grip for lighter things. You can just like squeeze things between your thumb and your knuckles. Some people get a surgery called a tendon transfer surgery, where they take a tendon from the bottom of the wrist area that comes from your elbow, and they twist it around and attach it to the top, and it gives your hands a clamp-like grip similar to the Lego toys. But so paraplegics below C7, full hand function, full arm function, a lot more sparing down the back. A T-spine will be down in lumbar, or T-spine injury all the way down to, is it T11 or T12? Forgive me, guys. I need to refresh my spinal column numbers. But in the lumbar region, if you're all the way down in the lumbar, you might be lucky in many ways, because you've got enough full upper torso where you don't need lateral supports to keep you from flopping out or flopping forward You can potentially sit up. You can even still have abs. You can do a lot of things. A lot atrophies in the upper body, so you can lose pectoral muscle as a quad. I'm very fortunate to have what I do have to pull arms forward this way, and fortunate that I can do a push-up. It's you lay flat on your belly. There's a lot you can do with exercises and especially Pilates-based spinal cord injury therapy. My favorite, I will shout out to Zebrafish Neuro. And I can lay on my belly and I can do a full push-up even without keeping the torso fully straight. Let's see. So a spinal cord injury is not a chronic illness. A spinal cord injury is just a result of traumatic spine damage. It can, I've known people who dive into a river and hit their head on a rock. I've known people who smack their head on a kitchen counter when their dog jumped on their back. I've known people who were drunk and they fall backward off a fire escape stairs. I've known people who got thrown from a horse or a bull and land on their head. Many of us are rollover car accidents or some kind of car accident where we get either thrown from the vehicle or snap our neck some other way. I know it sounds gruesome, but it happens. A little bit of history with spinal cord injury is my understanding that most people with a cervical injury did not survive before the 1920s, 1930s. Very few ever did. And nowadays we have emergency measures that allow for survival after such a catastrophic injury. Christopher Reeve was, to me, quite the vessel for one of the pioneers for bringing a whole lot more awareness to spinal cord injuries in North America, spinal cord injury rehabilitation, and a large part of the catalyst for what we have today in terms of facilities and rehab. Although rehab has shortened itself, I was fortunate to have 3 months worth. I believe in the 70s they would do six months or more, and back in the 50s you could, I'm assuming, you could do up to a year or more, 50s, 60s, a year or more of physical therapy and rehabilitative therapy, and I would love to see people still have full access to that. But just to say, to help anyone's curiosity out there, a spinal cord injury is not a chronic illness. It can lead to chronic illnesses. It can be a catalyst for many chronic symptoms. When people lose control of their bladder, their bowel, and we don't have full lung function, our upper lungs are compromised, we don't have a full cough. So it can lead to a variety of secondary complications, inflammatory challenges and issues, and I've spent many years rectifying, balancing, and finding ways that work for my own body to reduce and eliminate those kinds of challenges, and make life a little easier. I used to be in chronic pain, and I am no longer in chronic pain, and I learned a lot of things you adjust over the years to. Early on in the injury there's a lot more challenges, and you're still learning how to regulate, your body's learning how to regulate, and 15 years on for me now, it is very different than it was in the first few years. But I learned how to be less dependent on pharmaceuticals, less dependent on management, and more in the realm of regenerative experience, not necessarily fully recovering to the point of walking yet or anything, though I don't see that as I can see that as a possibility still. That is something that I desire, something that I still have motivation towards figuring out and creating for myself. But in the meantime, the measure of self-care it requires to take care of a body like this is a full-time job, and sometimes it's all you can do. So it's very challenging when you're doing both that and trying to live a full life at the same time. And you can live a full life. You don't have to give up on the things that you love. You just have to get very creative, and that's a big part of it. Chronic illnesses that relate to paralysis in the spine, things like ALS, Lou Gehrig's, MS is more of a musculoskeletal thing, but it kind of relates to the nerves. Parkinson's. These are neurodegenerative diseases or designations. My personal, this is not a medical diagnosis or opinion, and I don't have those certifications or qualifications, but my personal observation and study is that the neurodegenerative diseases that lead people to paralysis, such as tumors on the spine, Parkinson's, and so on, are curable and correctable in large part through natural means. Not saying it's a panacea, but there are ways to either mitigate, ameliorate, which means change a bit, reverse, reduce the intensity. A big part of this is to removing toxicity, inflammation, or as I call it, acidosis from the human body, boosting the endocrine system, and strengthening the detoxification organs, and moving excessive waste from the body that is causing obstructions to both energy flow, lymphatic flow, blood flow, and nerve function. And given the right elements, many people have reversed, or at least corrected, or at least relieved some of their suffering when it comes to neurodegenerative disorders. But again, I'm not the expert, and I cannot tell you fully how to proceed, because that's up to you. And I can only give you what I have experienced, what I have learned. My personal journey with this has to do with a few exceptions, a largely raw foods diet, a largely whole organic fruits diet, a lot of local leafy greens, and lots of herbs, and then the knowledge of herbology and the knowledge of detoxification and regeneration through the use of herbology and other alternative methods, so-called alternative methods in the world of naturopathy and so on. So that's my spiel about spinal cord injury, and I have no chronic illnesses. I have no diseases to speak of. All I have, besides the dis-ease that comes with paralysis, which is not a disease, it is a dis-ease at times, to be managing the symptoms of paralysis. That requires bladder catheters, that requires bowel management because you don't have control of bowels, that requires knowing what to put in your belly, that requires a number of other things, and having someone to help you with your personal care. I can drive a car, but I still need someone to help me with a shower. So, I mean, not that I can't do some of those things on my own, but it is much easier when you have help. So courageously and vulnerably, here I am sharing this with you just so that you are more informed, in case you wanted to be. And there are many studies in China from early on, 10, 20 years ago, where they were experimenting with the injection of umbilical cord blood cells and the removal of scar tissue from the injury sites, and they had some measures of success along with intensive therapy in regaining of function. For people who don't care to regain function, and yes, there are people who don't care to, you can perfectly, in countries where you're fortunate to do so and you have people who love you, you can live a full, fulfilling, happy life rolling around on wheels. So, yeah, hope that's some inspiration. And if you have any questions, please post them in the comments.